This is 9 News Now.
Renowned surgeon Dr. James Andrews says the hope is Redskins quarterback Robert Griffin III will be ready for next season following today's surgery to repair his right knee. The orthopedist who performed surgery on Robert Griffin III's knee is calling the operation a success.
Yeah, Dr. Andrews says the Redskins quarterback had surgery on both the LCL and his previously repaired ACL. And now the talk's turning to his recovery. So let's get to Kristen Bursett. What are you hearing so far, Kristen?
Well, Derek, right before he went into surgery, Robert Griffin III tweeted, "Thank you for your prayers and support. I love God, my family, my team, the fans, and I love this game. See you guys next season." According to Dr. Andrews, that's what we can expect. Like you said, Andrews fixed a tear in Griffin's LCL and ACL. Now, the tear wasn't a complete tear, but the ACL wasn't considered strong enough for someone in Griffin's profession. The expected recovery time for the rookie is 6 to 8 months. His rehab will focus on strengthening his quadriceps, which could help stabilize the knee. Dr. James Andrews released a statement saying Robert Griffin III had successful knee surgery earlier this morning. He had a direct repair of his LCL and redo of his previous ACL reconstruction. We expect a full recovery, and it is everybody's hope and belief that due to Robert's high motivation, he will be ready for the 2013 season. Now, if the recovery time holds true, Griffin should be able to participate in some preseason drills and be ready for the start of the season in September. We know he'll be determined to get there. Let's just hope they make the right decision when that time comes.
And of course, this is all guesswork because everybody recovers differently from these sorts of surgeries.
Right. We see, athletes, they have the best doctors around them and the best medicine, so they tend to recover a little bit quicker. But let's just hope, this is the guy's future. So let's hope that they're 100% sure before he takes the field.
Absolutely, Kristen. Thank you for that. Leslie.
Thanks, Derek. ACL injuries have ended the careers of many athletes, but treatment these days works a lot better, and now surgical repair is pretty common. Our Bruce LeShan talked with a surgeon who has done hundreds of these kinds of surgeries, and the outcome is pretty encouraging.
Yeah, Dr. Christopher McGee says that over at Washington Adventist Hospital says that if anybody has the intensity and motivation to recover from this, it is RG3.
For the patella in front with the patellar tendon.
The anterior cruciate ligament lies just behind your kneecap.
RG3 had an injury to his anterior cruciate ligament and also to the lateral collateral ligament.
Surgeons often cut the center of the patellar ligament and saw a piece of bone attached at either end and then thread all of that through holes that they've drilled to replace the torn ACL.
No, you cannot do it twice.
But because RG3 has already had ACL surgery in college, team sources say the surgeon was expected to take the patellar ligament graft from his left leg.
They used the mid portion of the patellar tendon from his opposite knee, so I'm told. I only know what I read.
The surgeon also had to repair the quarterback's LCL.
The lateral collateral ligament, the LCL, stabilizes the side of the knee, so essentially, it prevents the knee from opening up.
Dr. McGee says ACL surgery can be done arthroscopically through tiny incisions. The LCL is repaired with a bigger cut.
Sometimes a graft material will have to be used to take the place of a badly damaged lateral collateral ligament. Sometimes it can be sewn together.
After surgery, it takes months simply for the tough tendons and bone grafts to reattach themselves to the bone.
Do you think he's going to be just as explosive as he was?
I think if anybody can come back from something like this, it's a player of RG3's caliber.
Dr. McGee says you can have 1 or 2 ACL surgeries, but he is not too hopeful of a good outcome if RG3 has to have another one after this. So a whole lot of people are praying that this is absolutely the last time.
Yeah, let's hope the second time is the charm and not a third time.
Not the third.
Bruce, thank you for that. And so just what is the recovery and the rehab going to be like for this type of knee surgery? Our Anita Brickman is live at the National Rehabilitation Hospital in Northwest D.C. with more on that part of the story. Hi, Anita.
Hey, how you doing, Leslie? I'm joined by Dr. Carter Mitchell, an orthopedic surgeon from MedStar Georgetown, who practices with this hospital as well. And Doctor, you trained with Dr. Andrews.
I did.
Now, what's going to be ahead for RG3 in the rehab process? I mean, how painful is this to start, and what does he do in the days and weeks ahead?
Well, in the acute rehab process, what we want to do is control the inflammation in the knee as well as the swelling and try to get his range of motion back.
It hurts a lot, doesn't it?
It does. So the nurses will be taking care of his pain control and be very attentive to him.
But how long can this take? And we're talking about an elite athlete here, so some of them have come back pretty fast.
After an ACL and an LCL, we're talking somewhere between 8 and 12 months. However, it really is dependent on the patient.
Now, obviously, most people who have these tears are not elite athletes like RG3. There are a lot of these problems, right?
Approximately 250,000 ACL tears happen each year, and most of them are in recreational athletes. So what we like to do is focus on preventing these injuries mostly.
How can you prevent them?
Well, there are many techniques that we're studying, mostly strengthening the hamstring and getting mostly young women to land properly. So muscle memory and training is very important.
Now let's go back to RG3 briefly here. A lot of people are wondering, can he be at 100%, especially because we're not talking about this being the first ACL procedure, but the second and a revision to that. Can he get back to 100%?
Absolutely. I think there's no reason to believe that he won't get back to his previous level. We've come a long way with how we do these procedures and how we rehab from them.
Dr. Mitchell, thank you for that. And coming up at 5:30, we're actually going to meet a young woman who suffered the same kind of injury, and her physical therapist is going to show us a very cool anti-gravity treadmill that may be in the use for RG3 as well as the rehab progresses. Derek, we're going to send it back to you.
We're going to keep it optimistic, Anita. Thanks for that.
Well, as Bruce just mentioned, right now, Redskins QB RG3 is recovering from successful surgery to repair his injured right knee. Dr. James Andrews released a statement saying Robert Griffin III had a direct repair of his LCL and a redo of his previous ACL reconstruction. We expect a full recovery, and it is everybody's hope and belief that due to Robert's high motivation, he will be ready for the 2013 football season. Now, I am live at MedStar National Rehabilitation Hospital, where we're here to talk about the fact that it's not just football stars who tear their ACLs. Right next to me on this very cool looking treadmill is Miss Dorsey. Hello, how are you, Carly?
Good, how are you?
14 from Olney, Maryland. When did you tear your ACL?
I tore it August 18th playing for Sherwood High School volleyball.
What happened?
I was coming down from a block and I landed on the other player's foot and my knee just came in.
Did it hurt?
It did, but I wasn't really concerned about that. I just wanted to play and I knew it was serious.
So you could understand this quarterback not wanting to leave the game?
Yeah, I can.
Now, how are you doing now after the surgery in September?
I'm doing great. Recovery's fun and I love it, and I'm doing really well.
So we were just listening to Carly Dorsey, who had surgery for a similar injury that RG3 had back in September. Apparently doing better.
Yeah, she's only 15 years old, but she said the rehab was fun, was the word she used. I wanted to hear about how difficult or painful it might be. Hopefully we'll be able to get back to them a little later on so we can hear a little bit more about this rehab, because we know that while it's a challenge, obviously even a very young person can come through.
And she's an athlete herself.
There you go.
All right. He's out of surgery, and tonight, Robert Griffin III's surgeon says he's going to, or rather he's hoping the Redskins quarterback is going to be ready to go next season. But doctors did find more damage than they had hoped today. Kristen Brissett is here to tell us more about RG3's procedure.
Hey, Leslie, yeah, we knew he had damage to his LCL, but the surgery was to figure out if more damage had been done. I guess Mike? There we go. Okay, there we go. All right, so we know there was damage to the LCL, but today's surgery was supposed to find out if more damage had been done to the ACL, the one that he had hurt back in 2009, and really just how bad it was. Well, unfortunately, they found some more. Dr. James Andrews fixed a tear in Griffin's LCL and ACL. The tear wasn't complete, but the ACL wasn't strong enough for somebody of Griffin's athletic caliber. Now, the expected recovery time for the rookie, 6 to 8 months, better than we had hoped. Now, his rehab will focus on strengthening the quads, which should help stabilize the knee. We know how much he loves to run. Dr. James Andrews released this statement earlier today. Robert Griffin III had successful knee surgery early this morning. He had a direct repair of his LCL and a redo of his previous ACL reconstruction. We expect a full recovery, and it is everybody's hope and belief that due to Robert's motivation, he will be ready for the 2013 season. Now, if that timetable of 6 to 8 months holds true, Griffin could join his team in training camp and possibly start the season. But of course, only time will tell. I'll have more on Griffin's surgery coming up a little later in sports.
I'm Anita Brickman at MedStar National Rehabilitation Hospital in D.C., where the talk is all about RG3, his recovery from the knee surgery today, and specifically what kind of rehabilitation he can expect. Joining me now is Gina Brown, a sports medicine specialist, physical therapist. When does rehab start for RG3?
Tomorrow.
Tomorrow.
He will come back and he'll probably go to the training room or with a physical therapist, and their goals will be to basically work on decreasing the pain and the swelling that's in that joint.
It hurts a lot in the beginning.
It definitely hurts. So they'll be using ice therapies and also electrical stimulation to decrease the pain. And then also another form of electrical stimulation to work on recovering the function of that quadricep muscle.
What's going to happen there? What's he going to have to do?
He's going to have to put his leg up here, and it sounds simple, but he's going to have to make sure that he can fire this quad muscle by pushing that knee down into the table to make sure that it can work. And then after that, he'll have to do something as simple as learning how to lift his leg up again. And so he'll have to lift his leg up, just like so.
Wow.
It sounds simple at the time, but
it's hard in the beginning.
It's hard after surgery.
And then finally?
And then finally, the other things that they'll work on are increasing his range of motion for his knee flexion. So they'll use a strap or a towel or something like so, and they'll do something that we call a heel slide, where they'll basically be bending that knee back to work on improving that range of motion.
And as his incisions heal, what's next for him once that phase is done and he's back up on his feet?
It's possible that they might have him work a little bit in the pool to have him basically walk a little bit and decrease some of the weight bearing and everything he has to do.
And all this is as a progress over months, right?
Over months. Well, this phase is the first couple of weeks, and then he'll begin some much harder progressive strengthening and everything in the next 2 or 3 months.
And then hopefully be back on the football field next season.
That's the goal.
That is the goal. Gina Brown, thanks for joining us. Guys, we'll take it back to you in the studio.